Hello, my name is Kathleen Yao, and I am one of the nurse practitioners and the patient care coordinator at Heartland Center for Reproductive Medicine. We welcome you as you begin your treatment cycle with in vitro fertilization. My role is to provide you with education and support prior and throughout your IVF treatment. Currently, Heartland has 2 physicians and 2 nurse practitioners that you may encounter during your treatment with us. Dr. Victoria Macklin is the medical director of Heartland and serves as a reproductive endocrinologist. Dr. Jacques Ramey is also a reproductive endocrinologist and has a master's and doctorate degree with a focus on reproductive physiology. Ann Miller-Bode is a women's health care nurse practitioner and serves as the Egg Donor Program and PCOS coordinators. I am also a women's healthcare nurse practitioner and the patient care coordinator for Heartland. I would like to focus this presentation on understanding how we would proceed with a treatment cycle with IVF. An IVF treatment cycle proceeds with approximately 1 month of the patient taking a low-dose birth control pill. The birth control pill assists in regulating the hormones released that would naturally stimulate your uterine or endometrial lining to grow and your ovaries to ovulate. We also use the birth control pill so that we may appropriately time your treatment cycle so that you may start your IVF cycle around a certain date. We will also have you and your partner take the oral antibiotic doxycycline for approximately 10 days prior to the start of your IVF treatment. You will receive an IVF calendar and the IVF consents at least 1 month prior to your IVF cycle start date. Once you have stopped the birth control pill, we will schedule you for a baseline ultrasound between cycle days 2 and 4. With the baseline ultrasound, we will be able to evaluate the presence of any ovarian cysts from the previous menstrual cycle. We will also count and measure all of the follicles on your ovaries. A follicle is a fluid-filled structure that holds the egg and houses it while it matures. If no cysts are present, you will be able to start your ovulation induction medications as stated on your IVF calendar. We will also have scheduled at least 2 follow-up ultrasounds prior to ovulation to count and measure your follicles. Once a follicle reaches 18 to 20 millimeters in size, there is most likely an egg that has matured within the follicle and would like to be released. We will also be checking your estrogen and luteinizing hormone levels with your follow-up ultrasounds. Based on your previous fertility history and your fertility workup, a treatment plan for IVF will be created. Common oral agents are Clomid and Femara. Common injectable gonadotropins used are Follistim, Brevell, Gonal F, Menopur, Repronex, Lupron, and Ganirelix. Written patient instructions and video modules can be found online for many of these medications. We also have patient instructions on CD-ROMs and thumb drives that we have available for you. Please contact us for any reason if you have any questions regarding the administration of your medications. During your treatment, once we have observed follicles that are becoming dominant or are dominant and your estrogen and luteinizing hormone levels are rising appropriately, we will direct you on the specific day and time you should take the HCG trigger shot. After injection of the shot, the eggs are usually released from the follicle approximately 36 to 40 hours after the injection. Our staff schedules your egg retrieval based on when you take your HCG trigger shot. The egg retrieval is performed at Heartland Center for Reproductive Medicine's Ambulatory Surgical Center on the north side of our clinic. For the semen analysis, we ask that partners refrain from ejaculation 2 to 5 days prior to the semen collection. The semen analysis is performed at the Diagnostic Andrology Lab next door to the Heartland's Outpatient Surgical Center just prior to the egg retrieval. For the egg retrieval, transvaginal aspiration of oocytes, or the egg retrieval, is performed in the operating room at Heartland under heavy sedation. A long sterile needle is attached to a vaginal ultrasound probe, and the follicles containing the eggs are visualized by ultrasound. These follicles are aspirated, otherwise drained using gentle suction, and the follicular fluid and eggs are collected in a sterile test tube. The embryologist in the IVF lab removes the eggs from the follicular fluid and prepares each oocyte or egg for fertilization. The whole procedure takes approximately 30 minutes. However, you will spend time in recovery after the procedure so that we can monitor vital signs, fluid status, and pain status. The recovery nurse will review your discharge instructions in detail. These items may include the following: activity restrictions, drinking status, risk of ovarian hyperstimulation syndrome or OHSS, pain management, additional medications, follow-up phone call from anesthesia regarding recovery status, and a follow-up phone call from the clinic regarding fertilization results. The following slides will provide videos regarding the procedures of egg retrieval, conventional IVF, IVF with intracytoplasmic sperm injection or ICSI, blastocyst culture, and embryo transfer.
Transvaginal oocyte collection is a procedure designed to remove eggs from the ovaries. Eggs develop within follicles which can be seen by ultrasound. In this image, there are 4 or 5 follicles seen. The follicle is a fluid collection within the ovary which contains a single egg. The actual egg is microscopic and cannot be seen. During the process of ovulation induction, follicles grow in size until they contain mature eggs. Under a light anesthetic, a needle is guided through the top of the vagina into each follicle and the follicular fluid aspirated. Often, the follicle is flushed with media to assure the best chances of removing the egg. This procedure can be repeated many times. The needle is then moved to another follicle and its fluid aspirated next. The follicular fluid is collected in a test tube, and each test tube is passed to the laboratory where a highly trained biologist identifies the egg within the follicular fluid. This procedure is performed in an operating room. In this image, the surgeon is guiding the ultrasound transducer and watching the ultrasound screen to identify the location of the ovaries within the pelvis. An assistant is prepared to flush media through the needle to assure the best chances of egg recovery. Once the follicles have been located, a needle is placed through a guide on the transducer and under direct visualization advanced into each follicle. Follicular fluid is collected in a test tube and each test tube handed to the biologist for inspection.
Once the oocytes have been obtained, They are left in a culture medium distributed in 4 wells. Parallel to this, semen obtained through masturbation is prepared, separating the mobile from the immobile sperm and then concentrating them. In vitro fertilization, a microdroplet of concentrated sperm is added to each of the wells containing the oocytes.
In vitro fertilization, or IVF, begins with the woman injecting fertility hormones that stimulate the ovaries to produce multiple eggs in 1 month. When the timing is optimal, a needle is passed into both ovaries, and all of the available eggs are captured in a test tube. A common IVF retrieval will yield 10 to 20 eggs. Fertilization then occurs in a petri dish. With standard IVF, we take tens of thousands of sperm and place them around each egg. However, if sperm counts are low, then we help the sperm with a procedure called ICSI, or intracytoplasmic sperm injection. With ICSI, we can take the best sperm and inject them directly into each egg, essentially eliminating male factor infertility. Fertilized eggs, or embryos, divide in our laboratory for 5 days. Typically, we choose the 2 best embryos for transfer into the uterus. The embryos will attach within the next 48 hours. If there are any extra embryos, we will freeze them for another pregnancy a couple of years down the road. With IVF, good candidates can expect pregnancy rates upwards of 50 to 60%.
After conventional IVF or IVF with ICSI, the dishes are then examined the following day to observe if fertilization has occurred. If fertilization has occurred, the embryos are placed in a nutrient-rich culture media and allowed to grow for 5 days after the fertilization. Research has shown that if an embryo develops into a blastocyst, it may have a higher rate of implantation.
1 day after fertilization, the embryos are observed under the microscope. If fertilization has occurred, a single cell is seen containing 2 nuclei, male and female. Two days after puncture, the embryo divides itself and contains 2 cells with 1 nucleus per cell, which in turn starts to divide into an embryo of 4 cells if its development is optimal. 3 days following puncture, the embryo starts to divide and consists of 8 cells if its development is optimal. On day 4, the embryo divides a number of times, becoming a morula. This is when it begins to become compact. On day 5, the embryo contains more than 100 cells. In the center, there is a fluid-filled cavity. Finally, the blastocyst will shed the membrane that surrounds it. This is called hatching.
Embryo transfer into the uterus is a procedure that is scheduled 5 days after the egg retrieval. The embryo transfer is performed with ultrasound guidance. Therefore, we ask that you arrive with a full bladder to assist with visualization of the uterine lining. Your partner may be present for the procedure. Before the procedure, the physician will discuss with you how many eggs that were fertilized and had progressed to a 5-day blastocyst. The maximum number of 5-day blastocysts that will be transferred is 2. Risks of IVF are those associated with medication side effects, including mild bruising and soreness at the injection site, allergic reactions, gastrointestinal distress, headache, and mood changes. There's also a risk for ovarian hyperstimulation syndrome, or OHSS. What occurs in this syndrome includes electrolyte imbalance, fluid shifts from the blood vessels to surrounding tissue, collection of fluid in abdomen causing abdominal swelling, collection of fluid in lungs causing shortness of breath and respiratory distress, decreased and/or concentrated urine output. In severe cases of OHSS, blood clots can develop into the lungs, legs, and/or brain, and severe abdominal pain, nausea, and vomiting from enlarged ovaries and fluid collection may occur. According to the American Society for Reproductive Medicine, some older reports suggested that extended use, 10 years or greater, of ovarian stimulation medications put patients at increased risks for ovarian cancer. However, recent studies have failed to provide any convincing evidence that supports any association between fertility drugs and ovarian cancer. Risks involved in the egg retrieval include mild to moderate discomfort during or after the procedure, injury to organs near the ovaries, including the bladder, bowel, or blood vessels, bleeding from the ovary or pelvic vessels. Bleeding is normally mild, rarely requiring transfusion or surgery, and pelvic infection, which is rare. Risks involved with the embryo transfer include slight cramping with the insertion of the catheter into the cervix, and mild cramping, bleeding, or spotting after the procedure, which is also rare. There is an increased risk of birth defects in children conceived through IVF compared to those who are conceived naturally. Naturally conceived children have a 3 to 5% risk of birth defects. Some studies of babies conceived through IVF with ICSI report an increased incidence of rare defects, or less than 1%, of the following: imprinting disorders, including Beckwith-Weidman and Angelman syndromes, congenital malformations called hypospadias, which occurs with a urethra found underside instead of at the end of the penis, and sex chromosomal abnormalities. This concludes my presentation on understanding IVF. If you have any questions regarding your IVF treatment, please contact me at 402-717-4200. Also, there are a number of online resources and resources available in Omaha for our fertility patients, including the Omaha Integrative Care for Fertility, located in Omaha, Nebraska, as well as research online, including the American Society for Reproductive Medicine and the Resolve, the National Infertility Association. Thank you.